Question A is rat bite causes fever by toxin that is Streptobacillus mobiliform. Toxin can cause rat bite fever. An 18-year-old girl died of unexpected headache 2 days back. History shows autopsy shows lymphocytes in myocardial heart valve. What can be the cause? That is Coxsackie B virus. Chagas disease can also cause this one. Another one is significant increase in blood viscosity occurs in dehydration. In dehydration, there is increase in viscosity of the blood can happen. Next question is a woman with history of trauma, head and neck region lesion, tongue protrude, tongue deviated to the left side. Which nerve is most likely involved in the head and neck with tongue deviated to the left side? That is left hypoglossal nerve. Another one is a worker is being working near nickel metal shop. Which carcinoma is being predisposed likely? And that is lung cancer. Nickel can cause lung cancer and nasopharyngeal CA. Nickel. Then a patient had RTA, road traffic accident, does not know recent events as school events. What is uh, the region? That is hippocampus is the area for memory. A young pregnant lady having history of recurrent abortion with thrombosis. Most common autoimmune in young ladies with recurrent thrombosis, that is antiphospholipid syndrome. Another one is a patient with EPFOA negative Jones 1 and Jones 2 test, fluorescent test. What is the next planning? That is probing is the next planning. Apex of heart having arterial supply of left anterior descending artery supplies apex of heart. Next one is posterior one third of interventricular septum artery accompanied is middle cardiac vein in the posterior. Okay. Next one is the patient was taking warfarin and monitoring INR 2-3 normal range, and the patient took another drug in the chest infection due to INR increase. What is that drug? That is drug clarithromycin. Another one is carcinoma are usually very lethal. Which one of the following curable carcinoma? That is gastric carcinoma is curable. Patient working in mine has tuberculin test positive, present with cough, fever, weight loss, lymphadenopathy, and what could be the reason behind this? Reason behind this is silicosis. Silicosis induced TB can cause this condition in patient working in mines. Okay, next question is Parkinson's patient present with dyspnea after aspiration supine posture. Which lobe, right lower lobe, is affected because it is more prone to develop dyspnea or lodging of the objects. A boy had a car accident after which he is bedridden, developed DVT, deep vein thrombosis, came to ER with chest pain, dyspnea. What will be the finding? That will be ventilation perfusion mismatch. Okay, so next one is change in length of left atrial tracing can be due to which of the following? Can be change in left atrial pressure. Okay, next one is Babinski sign reflex, where big toe extends upward and other toe faces downward when the sole of the foot is stroked. The reflex is normal in infants but disappears as nervous system matures. How does Babinski sign disappear in the children? By formation of corticospinal tract. There are three types of the corticospinal spinal tracts, like dorsal column, medial lemniscus system, lateral spinothalamic tract, ventral spinothalamic tract. Dorsal column, medial lemniscus system is for fine touch and pressure with proprioception. Lateral column is for pain and temperature. Ventral is for crude touch and pressure. So, dorsal column, medial lemniscus system is proprioception, joint position, and Romberg sign positive when dorsal column is involved. So in this way, formation of corticospinal tracts removes Babinski sign. In metaplasia, if chromosome divides transparently rather than longitudinally, what will happen? The answer is C. Isochromosomes. Next one is which interleukin is required for maturation of red blood cell? That is interleukin 3 is required for maturation. A boy was continuously inhaled and exhaling into a paper bag for several minutes. Despite being advised not, after 5 minutes his colleagues noticed that his face was red and was hyperventilating. What is cause of this condition? Increased carbon dioxide in the blood. It causes lactic acidosis. A boy hit by something develops hand swelling. Fever is a fever by interleukin 1 mediated. What is the mode of action of the ipratropium? Ipratropium acts on muscarinic receptor to prevent bronchoconstriction. Ipratropium acts on